Right now, they talk to Jamie Jenkins, independent statistician, of course, our man down in Wales there, telling us what's going on inside the NHS. Jamie, good morning to you.
Good morning, Mike. If you get one of those spare Harry books, send one over. I might need to pop up a wobbly table at some point.
Yeah, well, I mean, if it gets a bit colder, you know, you can always chuck it on the old wood-burning stove. It might keep you going for a while in the absence of a few logs. But, yeah, it's a pleasure to be able to talk about something other than Prince Harry, actually, so I'm very glad to have you on. There's some figures out currently in the NHS. The one I was talking about there, the ambulances. I know that Rishi Sunak's claiming that he's fixing that, but I presume that'll be a long way off, won't it?
Well, it will be a long way off. I think the only way he's going to stop these kind of record numbers that keep coming out every week is, rather than throwing money at the NHS, it's throwing money at the people who do the data to stop them publishing it, because it's not going to be fixed overnight, Mike.
No.
I think probably let's start with some good news, on the home of common sense. One of the good news is that we've saw at the start of the week, didn't we? Everybody's saying potentially bring back masks, look at social distancing. You know, the NHS can't cope with all the COVID and flu. Well, it looks like I spent a lot of the last couple of years, Mike, coming on talking to you through the pandemic about COVID. Looks like we've actually peaked now with the current COVID wave that's been going across the country. So that's some good news. You can see the chart on the screen now, and if you listen on the radio, kind of plots hospital admissions now all the way back to kind of August 2020. You can see the big waves that we had in 2020-21 winter. And we have had waves through the kind of summer months, but remember, Mike, when we went into this living with COVID, we've been living with these kind of mini waves that have been going on, no restrictions, no masks, and the trajectory seems to be pretty similar now to what we saw then.
What do you mean that all those people claiming that we should be wearing masks at the beginning of the week were getting it a bit wrong?
I think so, Mike. Yeah, I think they've been, they're completely getting it wrong, because the trend's pretty similar now. It goes up for about 5, 6, 7 weeks, then it starts coming back down again, and that's kind of what we've got at the moment. And remember, the thing is, you go on social media, Mike, and some NHS organisations, NHS bosses go on television and they start giving you these big numbers. So they'll say 9,500 patients in hospital kind of with COVID. What they don't tell you then is 62% of those are mainly in the hospital for other things, but they've tested them. Right. And they also don't tell you they're on 1 in 3/4 in hospital. So the big issue with the NHS at the moment, Mike, is not the COVID problem. It's not the kind of flu. They are putting pressure on the NHS. But if you tot up all of the COVID patients who are there for COVID, all of the patients in hospital with flu, is actually a lot less than the number of patients who are in hospital who are fit to leave. We know we've talked about this in the past, fit to leave, and they can't leave. It's just under 13,000 of those. And a remarkable number, Mike, is on Christmas Day in the NHS, there was 11,795 patients who were fit to leave the NHS but couldn't because of the lack of onward care, etc. That's 12,000 people. I'm sure they would have liked to have gone home for Christmas. The NHS, in a way, Mike, has become a bit more of a hotel service for people, and it needs to be kind of fixed. Yeah. And on the screen now, we've got kind of data around critical care. You can see that during the 2021 wave, we saw a massive number of patients in critical care beds for COVID. And that's pretty much non-existent now. So 1.3% of all the critical care beds now in England have got a patient predominantly from COVID. It's about 47, Mike. At the peak, it's 3,816. So this is not a virus that's putting people seriously ill in hospital anymore. But some news outlets in the past week would make you think it is.
Well, exactly right. I couldn't believe the kind of sort of scaremongering that was going on with some, particularly online outlets, talking about, this new thread, this new variant of COVID that was coming through. It was only towards the middle of the week they started saying, oh, actually, it turns out it's not actually very dangerous, this new variant. It's actually less dangerous than even an Omicron was, which wasn't very dangerous at all. So, I mean, what's staggering to me, though, Jamie, is you're basically telling me that there's no room in hospitals if you're sick because the people who are occupying the beds should actually be in hotels. Funnily enough, there's also no room in the hotels because they're all full of migrants. So, we've got two basic problems here which could be solved at a stroke by this government if they had any cojones. If they could stop the migrants coming and if they could get the care homes back working and get them actually to open up properly and to stop this kind of COVID madness, which a lot of the hospitals got involved with in the last week or so, suddenly there'd be an ease with which people could be taken into hospital, treated properly, and people could get back to actually, you could even put some of these people from the supposed care home sector in the hotels the migrants are in.
And the thing is, Mike, this isn't going to be fixed overnight. As you know, you can't just suddenly find staff to to work for these kind of carers. It's a long-term problem. Remember Theresa May, Mike, when she lost her majority, which is basically why we ended up with that carnage of the Brexit votes going on back and forth, back and forth, back and forth, because she tried to sort out social care. She was going to kind of make people pay a bit more for social care, and then people don't want to pay more for social care. That's part of the problem you've got there, Mike. But you're right. If this big problem that we've got in not getting patients out of the hospital, and it comes back to if we caved in this winter and brought in some restrictions because of respiratory viruses going up, which we know every single winter, when we know that there's a bigger problem within the social care sector, well, it'll be the same next year. What will it just be called? Why don't we just start masking people from November to February every single year? Absolute nonsense in terms of what we're kind of talking in terms of this, Mike. And we've, got to stand a bit firm, look at what's really going on. And for me, the big question as well is, have we got to look at the NHS kind of bed capacity compared to what we've had in other countries that seem to have the similar problems with what we've got?
Yeah, well, I mean, certainly there are those who would say the bed capacity in the NHS is not what it was, but an awful lot of the reason for that is that, as far as I know, a lot of hospitals still haven't stopped the social distancing measures that were brought in during COVID. So it means that if for every ward you've got about a third less beds. And I think a lot of hospitals haven't fixed that yet.
It's not as bad as what it was during the pandemic, Mike. There'll be probably some different parts of the country will be managing it differently, because remember, it's managed differently across the country, the NHS. But overall, the big thing, if you look at critical care beds, actually, Mike, we have actually got more of those than what we had before the pandemic, slightly. But if you look at the percentage of beds that are being occupied in critical care, and again, they're saying the NHS is in crisis, there were, as total of all the beds that we've got, Mike, there was a higher percentage occupied during the 2017-18 winter. So, in terms of that, it's not as bad as what it was. So I think for me, it's just some carnage with the NHS. I can guarantee, Mike, you may as well book me in now and get your producers to book me in beginning of next January. We'll probably be talking about a similar topic. We'll be talking probably about, with general election, and this is going to be the big thing on there. This isn't going to change, Mike. You can go back, look online every single winter, the last 21 years, NHS in winter crisis.
Yes. Well, look at this from Carol, who says this. My son could have vacated a hospital bed yesterday, but nurses were unable to locate anyone to discharge him, so he's been there for another night. And here is the problem. She says there's very little COVID in our hospitals in West Wales. My son's in at the moment, but here we go again with masks. There's more flu around. I grew up with flu. We never wore masks. Plus, people who hid away for the last 2 years are catching everything. I didn't. And that is another problem, isn't it? The attitude of the health service in this country now is ludicrously cautious. They're basically telling you, if there's any chance you might get sick, whatever you do, don't go out. Well, that's called life, isn't it? You go out, sometimes you catch things, sometimes you get a cold, sometimes you might even get flu and be bedridden for a week. It happens. It's happened to me a couple of times in my life. You're not going to stop disease by telling everybody not to go anywhere.
And one thing as well, Mike, linked to that is, remember they were saying just before Christmas, don't go visit your loved ones if you're not well as well. And for some of those loved ones that you may go and visit, it might be their last Christmas that you could spend with them as well. So staying away from everybody, you're right. Remember, we're all born to live. We're not born to kind of hide away from everybody. No. People are, some common sense. If you've got a really bad virus and you're not going to go and infect everybody, but if you've got minor sniffles and stuff, how do you decide yourself if you should stay in or go out? I think, some of it is just absolute nonsense in terms of some
absolutely.
Of
and let's finish up with a little bit about our good friend Mr. Mark Drakeford, or Kim Jong Drakeford as he's known. How much did it cost for us to send him to Qatar?
Yeah, so the story coming out this week, obviously, he stayed in the 5-star Ritz-Carlton hotel in Qatar. Now, that didn't cost us anything, Mike, because that was paid for by the Qatar kind of government. And he claims that he had to stay there for security reasons.
Oh, so he's now in the pay of the Qatari government, is he?
Well, yeah, and to be honest with you, Mike, if he'd stayed in one of those fan zones, I doubt many people would even know who he was.
No.
Because he's well known across the world. But to get there, it was £13,000 of taxpayers' money for his flight and two officials. And then the economy minister, Vaughan Gething, went out as well a couple of days later for another football match. And to be honest with you, Keir Starmer said, the Labour Party, we're not going to be going to Qatar. We're going to boycott because of the human rights records. And Drakeford reckons he was going out there to kind of make a stand and trying to get them to kind of change and protest and things. I can't imagine he was doing any of that, Mike.
I mean, 13 grand for some flights doesn't sound like economy prices to me either.
Well, I got a mate of mine who went out for one of the Wales games, Mike, and he paid $750 return on Qatar Airways. So there was obviously a lot more cheaper options to get out there. But, you know, in a cost of living crisis, paying for all these, like, he shouldn't have gone there in the first place.
Of course he should.
I think.
And I mean, also the idea that, well, we're going to go and watch Wales representing the country in the World Cup. Well, why? You know, because obviously Wales didn't bother trying too hard without wishing to put too fine a point on it. They didn't exactly set the heather on fire, did they? But listen, great to talk to you, Jamie. Thank you very much indeed. Jamie Jenkins, independent statistician there with some figures on the NHS.